Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat, another episode, your Tuesday night slot by the Islamic Medical Association Health Professionals, empowering you and serving Allah through educational programs and other forums like this one. Tonight, inshallah, we will be discussing infertility, and our guest tonight is Yusuf Dasoo, an infertility specialist, an obstetrician and gynecologist from Johannesburg. Assalamu alaikum, Yusuf. Welcome to the show.
Wa alaikum salam. Jazakallah for the invitation, and assalamu alaikum to the viewers as well.
Jazakallah khair. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على أشرف المرسلين سيدنا محمد وآله وأصحابه أجمعين. We take our inspiration and our guidance from the Quran. So while we will be talking about the physical disease, we definitely must not forget that our source is the Quran in everything, and the spiritual component that we always rely on. In the Quran, in Surah verse 42, verse 49, to Allah belongs the kingdom of the heavens and the earth. He creates what He wills. He bestows female offspring upon whom He wills, and bestows male offspring upon whom He wills. And then again in verse 50, or He bestows both males and females, and He renders barren whom He wills. Verily He is the all-knower and is able to do all things. So obviously we know that in the end of the day, it is Allah who will determine who will get children, who won't get, how many, and what the gender is. But that doesn't circumvent us from seeking treatment, because again, we get an example from the noble Prophet Hazrat Zakaria alayhi salam in his dua. And he invoked his Lord saying, "O my Lord, grant me from you a good offspring. You are indeed the all-hearer of invocation." So of course, we must always remember, it is only Allah who will at the end of the day determine what the outcome is. But at the same time, He has given us the skills and the knowledge to try and seek cures. And although infertility is sometimes not seen as a disease, it is definitely a medical condition that can be treated, and Allah has given this kind of knowledge to our health professionals, and hopefully Yusuf will elaborate a bit more tonight. Yusuf, just to start, I think just to set the scene, what is infertility? I mean, can you just briefly go through a cause, and perhaps slide 2 can come up on the screen, inshallah.
I think there are many different definitions for infertility in our textbooks, but by and large, the majority accept that it's an inability of a couple being unable to conceive after at least 1 year of trying to have a baby, having unprotected and regular intercourse. Now, that's the definition. So, in a nutshell, people should be trying to have intercourse regularly. In other words, don't have intercourse once a month or twice a month and then feel that there's a problem. So there's a strict definition to say that try it regularly, no protection for at least a year, and then if you haven't fallen pregnant in that particular time, then we say, okay, you may be now having a bit of a problem.
Okay, so again, the message is you've got to try for a particular time. This has been worked out in the medical fraternity as a definition for a period of a year. So again, simple principle, you've got to put in some effort before you expect some results.
Absolutely, absolutely.
Okay. All right. So when does one really worry about the fact that they may have a problem?
So, if we use a definition as a guideline,
right,
we'd say that most couples will fall pregnant between 6 months to a year. If you're looking at pure statistics, then we would say about 60% of couples will fall pregnant within 6 months, and 90% of couples will normally achieve a pregnancy within a year of trying. So if after a year of trying you haven't conceived, then alarm bells should start ringing and say, well, maybe I have a problem. They may not have a problem, but it's now time to perhaps start seeking some medical advice or some medical investigation, so that one can try and see, is there a problem or is there no problem at all?
So that's a broad guideline.
That's the broad guideline.
Okay.
I just want to mention something, Yakub, that it becomes a little bit more of a problem when you're over a certain age group. So if you're younger than 35, you have time on your hands. And that's an important point I think we need to put forward to our viewers and highlight, to say that if you are under 35, yes, you have time on your hands, you can wait a year, you can even wait 2 years sometimes. But once you go beyond 35, or you're coming very close to that age, one's natural ability to fall pregnant starts also reducing. And then time becomes a factor, and time becomes important. And under those circumstances, maybe you'd want to seek help a little bit earlier, maybe after 6 months or 9 months.
And that will obviously tie up with the causes, right? As you get older, some other medical conditions may set in. It also impacts on the causes, which we will discuss later, the actual medical causes for infertility. But how common, firstly, is this problem in terms of, we would medically say the incidence, right? But it is fairly common. But how common is it? And slide 3 shows the kind of figures there.
Yeah, I think if you're looking at worldwide statistics, the average incidence of infertility is reported as between 10 and 15% of couples in the reproductive age group. So we're looking at people that are trying to fall pregnant. About 10 to 15% of them will not be able to conceive naturally, and that's why that's the incidence. However, in certain countries, such as in sub-Saharan Africa, the incidence has been reported as high as about 30%. So it differs in the different geographical distributions, but in general, 10 to 15% of couples. Now that statistic is what we know about. But as you know, infertility is often not spoken about, and people don't come forward. So the true statistic may in fact be a little bit higher than the 10 to 15%.
Yes, obviously people are reserved and they're not forthcoming in this particular condition, so they don't come and talk about it, they don't always seek help. The statistics may be a bit higher, the incidence, and then sub-Saharan Africa is almost double compared to global figures, so there are particular reasons for that, and it will tie up again when we're discussing some of the causes. But this whole problem of infertility, surely it must have an impact on both individuals, at an individual in the couple and within the marriage setup, and again obviously it goes beyond into the extended society. So what is the impact of this, and perhaps maybe slide 4 can come up.
You know, when you started the discussion, you mentioned that infertility may not be regarded as a disease, it's more a medical condition. In fact, the World Health Organization calls it a disease because it does affect couples to such an extent that it's now regarded worldwide as a disease process. Now, why is it regarded as disease process? One is that there are certain conditions causing it and certain medical conditions that will cause it. But more so, it does affect, as the slide will show, it affects the psychosocial stress in a couple. It causes immense relationship disorders. It causes depression and anxiety. It causes marital distress. So all that plays an important role, and the impact of infertility is not only felt in the immediate couple, it's felt in the whole family, the whole extended family, and there's a lot of stress from the extended family to be able to achieve a pregnancy. So yes, it's not only a major psychosocial stressor, but also it's a disease process.
So this would obviously require other professionals to come and help. Sometimes when you have these psychosocial issues, another team approach may be required. Psychologists, sociologists, social workers, that type of people. Sometimes do you draw on people like that?
Yeah, I think you've touched on a very, very important point, that it should be treated holistically. Not only go to a fertility clinic or go to a specialist, go to a gynecologist or your general practitioner. But many, many times they would require the services of a psychologist, services. We, in fact, in our clinic have a permanent psychologist. And because we feel that is so important, first of all, to be seen before getting assessed, and then during treatment and after treatment, because the whole idea of infertility is so stressful. We need to first set that aside. Then the treatment itself is so stressful, you need to get help that way as well. So it's a very important point that you've made.
Okay, so you have seen the positive impact and the outcome when the team approach comes in, and the psyche of the couple and the individual have been attended to.
Absolutely. I think you need to treat the couple holistically.
Okay, so we will be taking calls a bit later in terms of questions coming from you. So keep your calls ready. The number to dial will be 011 086 7701 or 2 or 3. I will repeat 011 086 7701 or 2 or 3, and that number is on the screen. So just keep your calls ready and you can start making your calls soon. The lines will be open. Before we start getting the calls, and I'm sure there's going to be a lot of them coming tonight, inshallah, perhaps, look, the next thing to do is the person and the couple, once they identify themselves and they agree that they need help, the first port of call should be a primary healthcare person like a general practitioner, who then they need to go and seek assistance from, and then he will go through their whole medical history and conditions, and then from there decide the point of entry to a person like you. But obviously in both that continuum of the care, the main thing is to look at obviously what is causing the disease. And we've got a few slides on that, so maybe slide 5 will start with the causes of infertility.
Yeah, I think this is a good starting point if we need to discuss infertility. But I think let's go one step back and let's talk about how does conception occur in the first place.
Very important.
Right?
Yeah, so what is fertility?
Yeah, what is fertility?
First,
Correct.
what is fertility? Then we go to what is infertility.
Yeah. And then if we can understand that, then we can look at where the problems may be lying.
Perfect.
So if we look at the picture of a female genital tract, right? We can say at the time
that is slide 5, eh?
Correct.
Yeah.
At the time of intercourse, okay, the male ejaculates sperm into the upper part of the vagina. Right. That sperm needs to first traverse the cervix and then enter into the uterine cavity.
Okay.
Once the sperm enters into the uterine cavity, the sperm has to find its way into either of the fallopian tubes. Usually enters both the fallopian tubes. From the female side, the ovary is responsible for making an egg, right? Once an egg is ripe, it needs to get extruded from the ovary, and that's a process called ovulation.
Okay.
And once ovulation occurs, the egg is now lying free. The ends of the fallopian tube, medically we call it the fimbria, has tentacle-like structures that allow for the egg to be able to be sucked into the fallopian tube. And once it enters the fallopian tube, and if intercourse is timed well and is occurring at the right time, that ovulation is taking place, then the sperm and the egg would need to meet, find each other, and a process of fertilization then needs to take place. Once fertilization takes place, cells start growing, and eventually an embryo forms. That embryo is formed in the fallopian tube. But as it's being formed, it needs to travel back into the uterine cavity, and once it gets into the uterus, implantation then needs to take place. And once implantation takes place, a baby will eventually be born.
Inshallah.
And alhamdulillah, we can see that, you know, it's such a complex process, but it takes place.
Yeah.
And that's really a miracle of Allah, you know.
True.
Now,
very true. I mean,
if we look at that, so many things can go wrong. And in fact, you know, if we start off and say that, what do you think is the percentage of patients or percentage of couples that will conceive when that process occurs? In fact, it's only 15%.
Sure.
So it's not very high every month.
Yes,
every month your chance is about 15% to be able to conceive naturally. So you shouldn't feel too despondent that it's taking 1 or 2 months or 6 months. It does take a bit of time.
Again, a teaching from Islam that we must be patient and persevere. It's one of the key principles in our teaching, and again we marvel at Allah's creation that such a complex process takes place every day, all the time, all over the globe. And then, as Yusuf is explaining, it's a 15%, and then it adds on as the months go on. We'll take a short ad break, and then when we come back, we'll discuss the causes. But those of you who want to call in, please feel free to do so. 011 086 7701 or 2 or 3. And I'm sure you are dying to pose your questions to Dr. Yusuf Dasoo. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. Tonight we're discussing a very important topic on infertility, something that is affecting many couples. Many couples anxious about this. We discussed that earlier, the impact on the family and the couples, the psychosocial element. We were discussing what is normal, which is the fertility, and how does normal birth occur in conception. And now we will go on to the causes of infertility, but we are waiting for your calls on 011 086 7701 or 2 or 3. So please do call. Dr. Yusuf Dasoo is our guest, and he is quite ready to take your calls, inshallah, and try and answer them to the best of his ability. Yusuf, while we're waiting for those phone calls to come in, causes of infertility. Slide 5.
So, Yakub, we mentioned how normal conception occurs. It's then easier to understand what do we need to look out for as to why couples then won't conceive or will have difficulty in conceiving.
Okay.
So we mentioned that the ovary is responsible for producing an egg, and that egg, when it comes out, is called ovulation. Now, if an egg is either not being produced at all, or it's being produced but not coming out, then there's an ovulation problem, right? So that's the first part. Is somebody ovulating or not? So that's the first cause. Problems with ovulation, okay?
So can we pause there, right?
Sure.
Because there's so many elements, so maybe we can take it steps. So problems of ovulation, basically the egg not coming out, and many females that come to our general practices, there's one of the main things they say, it's all my fault. Usually we find that the male element tends to be in the background, saying the female comes forth. And this seems to be a big thing. And so how important does anxiety play in that role? Because she feels she's the guilty party. And maybe perhaps we can just touch on ovulation a little bit.
So yeah, there's certainly some evidence that a person that's very stressed, right? Even somebody that loses weight suddenly and loses body fat and their body mass index drops, they have been shown to affect the brain to such an extent that it can affect ovulation. Now we know that ovulation takes place by a very finely tuned process that's controlled by the menstrual cycle, okay? And the brain or the hypothalamus of the brain,
which is in the brain,
right, controls certain hormones that are responsible for another set of hormones to be produced from the pituitary gland,
which is also in the brain.
It's also in the brain. And then that hormone from the pituitary gland goes into the bloodstream, then goes to the ovary, and that triggers off the process of egg development. If an egg develops, then there'll be a reverse process back to the brain to say that an egg is developing, and that's the finely controlled process. Now, if there's a problem in that process, we simply call it there may be a hormonal problem. And that's what we mean when we call, so something is wrong with your hormones. Okay. There's a hormonal problem, and that hormonal problem is making you not to ovulate well. Okay. Now, that's responsible from the brain, like we mentioned. The pituitary gland or the hypothalamus can be affected by stress, can be affected by weight loss, can also be affected by certain medical conditions, such as thyroid disease. There's a condition that causes a high prolactin level, and that prolactin level also can inhibit ovulation. So those are the higher functions that may be affected by controlling the ovary.
Okay, we got a caller on the line, so we'll continue with explanations if need be. But it's very important because we want this to be interactive and we want the callers to call in. Assalamu alaikum wa rahmatullah.
Wa alaikum salam wa rahmatullah. How are you?
Alhamdulillah khair, man. You can go on with your question, brother.
I would like to know, I'm an adult of 41 and my wife is 29, sorry. I'm in the process of doing IUI.
Okay.
How successful?
Yusuf, IUI, that is one of the treatment modalities, which is quite specialized.
Correct. So IUI, just for the rest of the viewers, means intrauterine insemination. It's one of the processes that we use to try and assist couples that are having problems in trying to achieve a pregnancy, when either there's no obvious cause found, or if there's a mild male factor problem, or there's mild
hello?
endometriosis. Now,
Hello?
Brother,
Jay?
can you hear us?
Yeah, one second. I have a low sperm count, which is about 10 million, if I'm not mistaken.
Right. So that's a good starting point, that if you've just got a low sperm count but all your other sperm parameters are okay, then one can try IUI. Now, IUI depends on a normal fallopian tube and normal ovulation to take place. Or if normal ovulation is not taking place, then it can be induced with medical therapy. Now, what will happen is that the sperm would then be obtained, and it will undergo a process of sperm washing. Okay, and once sperm washing takes place, then we have a concentrated sperm and highly motile sperm. And this specimen is then inserted into the uterine cavity to allow for fertilization to take place. But it will take place naturally, because all we're doing is allowing a very concentrated, good quality sperm specimen to be inserted into the uterine cavity at the right time that an egg is coming out. But your body, or your wife's body, will still have to do everything else to allow for fertilization to take place. Now, the success rate is in fact slightly more than natural conception, because natural conception, as I mentioned before, that if there's absolutely no problem, the chances of falling pregnant is, say, 12 to 15% per cycle. This would increase your chances to about 15 to 18% to allow you to achieve success. So you asked me, what is the success rate? It's between 15 and 18%.
And how many times should one try if the first one fails?
Yeah, I would say it depends primarily on how severe the sperm factor problem is. If there are other problems with sperm parameters, then I wouldn't try more than, say, 3 times. That would give you at least about a 50% chance cumulatively, all right? But let's say, for instance, if there's not so bad a sperm problem, and if the only problem is a low count, but the quality is good, the motility is good, there's no anti-sperm antibodies, then one can try up to 6 times. And that many people will be able to achieve a pregnancy within the 6th attempt.
And is there a possibility to strengthen the sperm?
Yeah, that's a very good question, and it's a very difficult question just to answer without knowing the full history on an individual basis. But on a general basis, there are many things that one can do to improve the sperm count, sperm quality. But it depends on the causes. So if you've been assessed and there's no obvious cause, then the first thing that one would like to do is just lifestyle modification. You know, if you're smoking, you stop smoking. Obviously, there won't be alcohol, but let's say, for instance, if you're obese, you try and lose weight. You exercise. Try and avoid, very hot baths and, saunas and jacuzzis and all those type of things that would influence sperm function or spermatogenesis. So if you do those simple things, lifestyle changes, you'll find many people will improve their sperm count that particular way. There are some multi-nutrients that have also been shown to improve sperm count quality. The ones that are antioxidant type, and simple vitamin C. Vitamin C is an antioxidant, a very good antioxidant. Zinc is a very good sperm improving factor. So those two together can be taken, and that would also improve your sperm count.
And sperm aid?
A sperm aid, you'll find that if you check it up, it has quite a lot of antioxidants, and it does contain zinc, so it can improve in some individuals the sperm count.
Okay, Jazakallah khairan for your help.
You're welcome. Inshallah, your wife will fall pregnant, and we make dua for you, inshallah. We're waiting for more calls. The number is on the bottom of the screen, so please call in. We're discussing causes. We were busy with the ovulation. Obviously, that whole tuboperitoneal component is the one we're highlighting at the moment as we move on. So perhaps we can still go back to slide 5 and just see how far we get with the thing.
Yeah, I think we were, Yakub, we were discussing ovulation problems, and we mentioned most of the higher function problems. But one of the very, very common problems with ovulation is a condition called polycystic ovarian syndrome.
Okay.
Now, polycystic ovarian syndrome is considered to be a metabolic disorder. Yes, it does cause hormonal imbalance, but it's a metabolic disorder. So it affects a wide variety of different organs and a wide range of things. But in a nutshell, it does affect ovulation. And you'll find that patients that have polycystic ovarian syndrome, many of them will have irregular menstrual cycles. They often miss their menstrual periods for at least 2-3 months, and sometimes they don't see it at all, or they see it once or twice a year. And that would be a good indication that ovulation is not taking place. If you're not having regular menstrual cycles, the first thing that would alarm us, or should alarm an individual, is that if I'm not having normal menstrual cycles, then I'm probably not ovulating every month.
Okay.
So that's another important cause of female factors in terms of infertility. And that would sum up ovulation as one of the causes.
That is obviously the reason when they come to us, before we refer them to you, we ask them to document their menstrual cycles for at least 3 to 4 months, the beginning date and the end date of that, and gives you some kind of indication on the regularity and the length of the cycle. And many times we find patients and females don't tend to pay attention to that little detail, and yet it is so important in initiating the treatment and perhaps establishing the cause.
Yeah, I think that's very important. We do find that in practice that, you know, if you ask a patient when was your last period, then they won't remember,
Yeah,
you know,
sure.
and are you having regular periods? They'll say, yes, it's regular, I see it. But if you really go deeper into it, you'll find that it's actually been quite irregular, because they may see it one day on the 20th of the month, the next day they see it on the 5th. So they think it's regular because they're getting it every month, but it's actually not that regular.
Perhaps maybe a question will come through, but I thought maybe I must bring it up now, Yusuf, is, you know, we find quite a few patients that they've decided to go the contraceptive route in the early days of their marriage purely because they're settling in, and then they decide, no, okay, now it's time to fall pregnant. They attempt a few times, and then they have some difficulty, and they tend to blame the contraceptive. Now, is that a myth, or is there some truth in that?
Yeah, just to sum it up, it's a myth.
Okay.
Okay, to sum it up, it's a myth. And as you know, you see it in your practice, I see it in my practice, that many young girls come to you and they have problems with their menstrual cycle, and they need some type of treatment because either their periods are very long, or they don't see it for a long time, and it's disturbing their normal lifestyle. And one of the fundamental treatments is actually the use of oral contraceptive pills.
To regulate the cycle.
To regulate the cycle. I mean, you can't have a young individual, 17-year-old, who's bleeding every day for the last 2 weeks heavy. She's going to become anemic, and there's going to be complications from that. And the treatment of choice would be an oral contraceptive pill. And they often come with their mothers, and when they come with their mothers, the mothers have concerns. Is my child going to have a baby? Is he going to cause? And I can rest assure you that an oral contraceptive does not contribute to causing fertility. Yes, she may experience fertility for certain times, for different reasons, but not because of the contraceptive.
Okay, so he's putting that myth to rest, inshallah. Caller on the line, Assalamu alaikum wa rahmatullah.
Assalamu alaikum.
Hi, brother.
Yes. My name is Fahim. I'm calling from Johannesburg.
What's your question?
I don't have a question. I'd just like to compliment Dr. Dasoo. My wife and I tried the IVF 3 years ago, and it was successful, and he was the doctor in charge.
Alhamdulillah.
Yeah. We have a 3-year-old boy who's now the sunshine in our life. And I just want to congratulate Dr. Dasoo for being responsible. And although everything happens with the will and grace of Allah, we appreciate his professionalism throughout the entire process.
Jazakallah for the compliment, and Yusuf, Allah reward you too and grant you a healing hand in the work that you're doing, and good luck to you and your family, brother, and make your child the coolness of your eyes, and grant you all the path of Siratul Mustaqim, inshallah. We shall continue with the show until we get the next call. Do we have another caller? Okay, the call is coming through, but we were just mentioning, you mentioned the oral contraceptives. What about the injectable? Does that impact? Oh, the caller is on. Okay. Assalamu alaikum wa rahmatullah.
Assalamu alaikum wa rahmatullahi wa barakatuh. I just want to ask a question. I'm now age of 45, and my doctors also said I'm not supposed to be using any tablets now, contraceptive tablets, because it affects my hormones and things like that. Is there anything I can use that's permissible in Islam? Because my husband is almost now 48, and I just want to know, is there anything that we can use? What's permissible?
Use as a contraceptive?
Yes.
Okay, so you want to continue with your family planning?
Yes,
Okay.
because I'm not sure what else can I do, because they said we can tie the fallopian tubes or something, but I'm not sure if it's permissible.
Okay. Yusuf?
Okay. If I'm getting your question is that you wouldn't want to use the oral contraceptive because that's a valid form of contraception Islamically, but you are concerned whether sterilization Islamically is valid or not. I'll try and answer that. I'm not a alim, so I can't give you a full Islamic viewpoint, but as a general rule, Islam allows you to perhaps have reversible forms of contraception. If you're going to undergo non-reversible or irreversible forms of contraception, then it may be a problem. And the question is a sterilization a reversible form of contraception or not? Now, we are well aware that a sterilization is a way to block the fallopian tubes. However, it can be reversed. In other words, surgery can be undertaken where the fallopian tube can be reconnected and a pregnancy can ensue. So, in theory, that's a reversible form of contraception. If, however, you remove the entire fallopian tube, then that's irreversible. Or if you do a hysterectomy simply for the purposes of not being able to achieve a pregnancy, then that's a non-reversible form of contraceptive. So I think from my understanding is that sterilization would be acceptable if it's done just to block the fallopian tube, but if you're removing the fallopian tube or doing a hysterectomy, then that's not allowed Islamically.
Okay, Jazakallah khair for that answer, and I hope the sister is benefited from that. We got another caller. Assalamu alaikum. Okay, the call is coming through. So obviously we spoke about reversible, and those are important matters too. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Dr. Dasoo, could you please tell me excessive exercise and poor nutrition, does it play a role in infertility?
Yeah.
It's a good question.
It's an excellent question because there's a lot of controversy around that.
Yeah,
now, the first thing is poor nutrition. I think there's no doubt that poor nutrition does affect all forms of fertility. It's a known fact that if you don't have a healthy diet, don't have a good healthy lifestyle, you don't exercise, you eat unhealthy, it's going to affect fertility. And not only does it affect fertility, it also affects our success rates in trying to achieve a pregnancy. So from a nutritional point of view, it's very, very important to have a good and healthy diet. In terms of exercising, now that's the contentious issue. A lot of people are saying, well, cyclists, for instance, because they cycle for such a long period of time, they external genital area may experience a lot of heat dissipation.
You're talking about the males?
From the male side,
okay.
From the male side.
Yeah, okay.
From the male side, if you're cycling, you're going to get a lot of heat dissipation, and because the external genitalia needs to be on the outside, spermatogenesis needs to take place at a lower temperature, it may affect it. But in fact, most of the studies have shown that regular exercising is good for you. Okay, if you go to the gym, you run on the treadmill, you cycle a little bit, it certainly won't affect fertility from that point of view. However, I think anything in extreme is going to be a problem. And if you go, if you're going to cycle every day, 100 Ks a day, you're going to then start experiencing certain forms of high temperatures, and that's going to affect spermatogenesis. From a female point of view, nutrition, we have the conditions such as anorexia nervosa, bulimia, poor nutrition, extreme loss of weight. No doubt, there's many young women who undergo that. They become amenorrheic, they don't see their period, and therefore will not ovulate. So certainly that will affect fertility.
Jazakallah for your call, brother. And again, the message is to do things in moderation and then keep a perspective of what you're doing.
Excuse me, I'd like to know specifically, excessive exercise in a female, does that have any influence on ovulation?
I think if you excessive exercise to such an extent that you decrease your body mass index to a critical level, then it's going to affect it. Otherwise, on the whole, it just depends on what your definition of excessive exercise is. But I think if you're gymming an hour a day or 2 hours a day, that shouldn't really affect fertility.
Jazakallah khair.
Thanks for the call, brother. Jazakallah. Again, a message, do things in moderation. We'll take a short ad break and then we'll be back after that to take your calls. We have the number at the bottom of your screen. It will pop up again, 011 086 7701 or 2 or 3. Please keep your questions ready and we'll be back shortly. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. Our topic tonight is infertility. We have a guest in the studio here, Dr. Yusuf Dasoo, an infertility specialist. We've had a few calls. We are expecting a few more before we wrap up. So please do call in 011 086 7701 or 2 or 3. The number is at the bottom of your screen. Yusuf, so perhaps maybe as we're discussing some causes, we can go on to a few more. Are we still talking about female causes?
Yeah, still female causes. So we just mentioned the very start, which is ovulation. So now let's go back and say, all right, now that egg needs to enter the fallopian tube, and if it enters the fallopian tube, it needs to meet with the sperm. So what do you need? You need a normal fallopian tube, a fully functional fallopian tube. So what causes problems with the fallopian tube? And there's two major problems that would cause...
Slide 8 you want, or slide 7?
Slide 6 is fine.
Slide 6 is fine.
Slide 6 is fine. And two major causes that causes problems of the fallopian tube would be an infection that has damaged the fallopian tube. So you're either going to get a blocked fallopian tube or a damaged fallopian tube. Sure, we can.
Okay. Assalamu alaikum.
Wa alaikum assalam. I'm calling from Johannesburg. I just wanted to ask you that where is your consult? I want to consult you personally. So I just wanted to know where is your clinic?
The clinic is in Brenthurst, but we can give you the details later. You can just phone the office of the IMA 011 837 67
011, the same number?
837 6717.
6717.
Yeah, you can call in and then just get the number from there, okay?
Okay,
Jazakallah for your call. Okay, so that was a patient that wants to see you, inshallah. There are other infertility specialists also in town, so we're not showing any bias to our guest, but Yusuf is a guest who's volunteered to come on. Can we carry on with the causes as we wait for the callers?
Yeah, so what would cause damage or blockage of the fallopian tubes? And the two most important causes, the first one being infection, and infection normally starts off in the lower genital tract and then extends up to the uterus and then damages the fallopian tubes, and that's a very, very common cause in South Africa. And another very important cause is a condition called endometriosis, and that's another condition that's increasing. Either we're looking more for it or it's increasing in incidence. And severe forms of endometriosis certainly will damage the fallopian tube and affect the process of the egg entering the fallopian tube to be able to get to the sperm.
And that's a common condition, endometriosis, and patients present with pain and ongoing pain, disturbances in menstrual cycle. So even if they're not looking for children specifically at the time, if they're having this persistent lower back pain, lower abdominal pain, pelvic pain with an irregular cycle, they should start consulting so that can be identified earlier.
Correct. Okay. And I think the more we're looking at and the more we're trying to see the cause for pain, we are finding more and more patients that actually present with endometriosis.
And then things like, you have a common condition called fibroids, you got it on the screen there. Issues with the cervix can be a bit narrow. May you want to just touch on one or two?
Yeah, sure. Then you get the uterus itself, right? So then the uterus is where the fallopian tube, where the sperms need to enter, and then where the actual baby will eventually grow or the embryo will need to implant. So any abnormalities there will certainly contribute to a cause for infertility. And as we've mentioned, the first one would be fibroids. Now, fibroids on its own will not cause infertility, but it has to be multiple. It has to occlude the fallopian tube, and that will often cause infertility. More so is fibroids can cause miscarriages. So they can cause a conception, but can cause miscarriages.
Okay, so we got a caller, and then we'll come back to that if we can. Assalamu alaikum.
Wa alaikum salam. I'm calling from Johannesburg. I just want to know something. Like, I suffer from bipolar, right? And my menses are like very irregular. But now I want to know if that tablet maybe that I am on, if that is the cause of it. I'm on Epilim. I have to take 800 milligrams a day.
It's a very good question.
Yeah, it's a very good question. There are certain drugs that does affect your menstrual cycle, your menstrual flow, but Epilim on its own should not change your menstrual cycle. So if you're having an irregular menstrual cycle, I don't think we can blame the Epilim for it. However, we know that certain anti-epileptic drugs, if taken with a oral contraceptive pill, then it will affect the efficiency of the contraceptive pill, the absorption of the contraceptive pill, and will either cause you to fall pregnant if you are not planning on having a pregnancy, but also will cause irregular menstrual cycles. But if you're not on any oral contraceptive pill, and if you're still having irregular menstrual cycles, then I don't think it's the Epilim causing it, and I think you can investigate that further.
Are you looking to have a baby?
Yes, in actual fact, we are wanting to have a baby, but like I just get my menses and then it stays away like for 3 months, and then I get it for 1 day, it goes away, I get it again the next month for 4 days, and that is how it goes.
So you actually need to consult somebody to try and address the menstrual regularity of your cycle first, and then perhaps take it further from there, and proper medical history has to be then done based on your medication you're taking and other factors that we've been discussing.
Yeah, because I think that I also should go and see a gynecologist just to, you know, find out before it's too late or something like that.
Yeah, no, I think it's a good idea.
Okay.
What do you think, Yusuf?
Yeah, I think what you're saying is that this irregular menstrual cycle is one probably a very it's trying to tell us, look here, ovulation may be a problem.
Maybe, yeah.
So that would be one of the important things to try and investigate. And there are simple tests to investigate if ovulation is taking place. It's a simple blood test. Your gynecologist or your general practitioner can do that. You do a certain blood test on a certain time of the cycle, normally day 21 of a menstrual cycle, and if that level, a test is called progesterone, and if that level is high, it's easy, you'll know whether ovulation is taking place or not. So that would be a good starting point.
That will be a good starting point indeed. Is that okay with you, sister?
Excuse me?
Is that fine? Will you start with that, your process to
Yes,
begin
sir,
that?
I'll do that, yes.
Okay, Jazakallah khair for your call.
Jazakallah.
Okay, so we continue, we're discussing the uterine component and then we're going further.
Sure.
So you're still busy with the female anatomy, right?
Yeah, we're still busy with female causes.
We've got another caller, yeah.
Okay.
Okay, assalamu alaikum. Assalamu alaikum.
Wa alaikum salam.
Go ahead with your question.
You're speaking to Zulfa. I'm from Cape Town.
Okay.
I am 24 years old and I have serious endometriosis. So I'm just wanting to know if I will still be able to fall pregnant, inshallah.
Okay, so Zulfa, I think you shouldn't worry. There are many people with endometriosis. As I've mentioned, it's a very common condition. They do fall pregnant spontaneously as well. Now, unfortunately, the more severe the endometriosis, then the higher chance that it may contribute to you having difficulty in falling pregnant. As we all, as the medical profession will know, there's different grades of endometriosis, grade 1, 2, 3, 4, and the very severe ones, the grade 3 and grade 4, certainly can cause difficulty in falling pregnant. But it does not mean you can't fall pregnant. Sometimes you may need a bit of assistance, and that will depend on whether you've got something we call chocolate cysts or endometriomas that may need to be removed. You can restore your anatomy and you can fall pregnant spontaneously. So I think what you should first do is try on your own. Okay, try on your own, see if you fall pregnant. You are still young, you've got many years ahead of you. Try on your own for at least a year. See, and if you don't fall pregnant, go and see your gynecologist. He can ascertain as to whether the endometriosis needs to be removed, and then he can help you try and fall pregnant.
How long have you been trying to fall pregnant, Zulfa?
I went for the op in February this year, so I have been trying for a couple of months now, yes.
Okay, so as Dr. Dasoo said, you still got good time ahead of you because you're still young. And Yusuf?
Yeah, did he mention whether your fallopian tubes are damaged or not?
no, he said everything is fine. I asked him about the ovulation process as well because I wanted to go on a tablet called Clomid, and he said it's not necessary for me at all. I must just be patient.
I think that's a very good way to start off, because if he's cleared out a lot of the endometriosis, and if your fallopian tubes are open, and if you're ovulating, then inshallah you should be able to fall pregnant on your own. And I think it's prudent for him to have said that you should try on your own at least for a year. And then if you still don't succeed, then he would maybe introduce these tablets such as Clomid, because taking medication has side effects as well and should only be taken when necessary.
Yes. Okay, shukran.
Shukran, Jazakallah khair. Afwan. Assalamu alaikum to the callers that have been coming through. I don't think the next one is coming yet. Okay. All right, Yusuf, so still with female factors?
Yeah, so I think maybe we have a limit of time, so maybe we must go a little bit faster. And I say, yes, there's problems with the uterus, and many of those, there could be fibroids, could be uterine abnormalities. There are many different types of uterine abnormalities. Then there's problems with sexual dysfunction, and that's a common problem. We see that in practice. I'm sure you see that in general practice. One of the...
That's slide 8, eh?
Yeah, you know, from the female side, there's a condition called vaginismus, and that's the inability to be able to penetrate the vaginal area to allow for intercourse to take place, and that will prevent sperm from entering. The same way from the male side, you can have premature ejaculation or ejaculatory disorders, and they can all contribute to having difficulty in falling pregnant. And then from the male side, as you mentioned, that we always say the males, they always feel that there isn't a problem. And in fact, if we're looking at statistics, then 30% of causes for infertility is actually caused by the male factor. The male factor. And the male factor is very important to be able to exclude as a cause of infertility. And that should be part of the full investigation process. So yes, male factors. The sperm is important in terms of the number of sperm, the quality of the sperm, are they swimming in the right direction, and that needs to be ascertained, because if there's any abnormalities along those parameters, it would certainly contribute to infertility.
Look, it's a huge topic. We haven't even got to what investigations need to be done and the different treatment modalities. But our intention, inshallah, is to maybe have another part 2 to this thing, Yusuf, and perhaps you or somebody else that's an expert in this particular area will be able to come in, and we can go ahead and discuss those parameters. But maybe today, just for today now, because we only got a minute or so left, maybe you want to just give a brief summary, a quick thing before we wrap up? Yeah, so just what we've touched on.
I think first of all, we must say that, we must know that investigations need to be started as soon as you think there's a problem. Okay, or rather, just not only investigation, first an assessment. An initial assessment, make an awareness, a proper diagnosis. We need to go through, the general practitioner or the gynecologist will need to go through all the different causes, and as we've mentioned, there's going to be male causes, there's going to be female causes, there's going to be male and female causes, and sometimes a small percentage of people will have no problem. Some people 3, 4, 5 years, 10 years, they're not falling pregnant. You do all the investigations and they're also not being able to fall pregnant, and alhamdulillah, maybe that's the best group to be in, and then obviously investigations. Now from
okay, so that's basically in a summary that you got to firstly bide your time, wait for the first year, try the natural methods, and then as time goes, go for what we've suggested. We will be wrapping up, inshallah, and we make the final dua that we say once we get our children, as has been stated, O our Lord, bestow upon us and our wives and our offspring, who will be the comfort of our eyes, and make us leaders for the muttaqeen, which is a very, very special dua, inshallah, for all those who will fall pregnant, and for the children. And those that haven't, we make dua for you, that Allah grant you the children that you're seeking, and that you all have a healthy life, both spiritually, morally, physically, in the obedience of the Almighty. We'll be back at this slot again next week, inshallah. Dr. Shoaib Wadi will be hosting, so don't forget your Tuesday night slot on health matters, comprehensive chat by the IMA. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair, Yusuf, for coming.
Jazakallah.
Assalamu alaikum.
Assalamu alaikum wa rahmatullah.